Hi everyone, I'm Bella Dallas, Professor Community Health Nursing Department in College of Nursing. Today we are going to learn about Nipah virus. The objectives of this sessions are the meaning of Nipah viral infections and the outbreak of Nipah infection in India, also the epidemiology of Nipah viral infections and the preventive measures of Nipah viral infections. This Nipah virus, it's a zoonotic virus. This virus transmitted to the human beings from the animals due to a paramyxovirus. It's a group of genus Nipah viral. This first identified in 1999 in Malaysia caused an outbreak of respiratory and neurological disease in pigs and encephalitis in people. As per the report of Ministry of Health and Family Welfare, the Government of India, 6 confirmed Nipah viral cases, including 2 deaths happened in Kozhikode district, the Kerala from the 12th to 15 September 2023. First case, the source of infection was unknown. The other cases were family and hospital contact of the first case. As of 27th September 2023, 1,288 contacts of the confirmed cases were traced, including high-risk contact and healthcare workers who are under quarantine and monitoring for 21 days. So quarantine means it's a isolation of the infected persons. Since 12th September, 387 samples have been tested, of which 6 cases were positive for Nipah virus infections and all remaining samples tested negative. Since 15 September, no new cases have been detected in the year of 2020-23. This is the 6th outbreak of Nipah virus in India since 2001. Past outbreaks of Nipah virus, the first recognized in 1999 during an outbreak among pig farmers in Kampung Sungai Nipah, that is in Malaysia. No new outbreaks since 1999. The first recognized in Bangladesh in 2001, and nearly annual outbreaks have occurred in that country since, with disease also identified periodically in eastern India. Serological evidence of Nipah has been found in the known natural reservoir in Cambodia, Thailand, Indonesia, Madagascar, Ghana, and the Philippines. In Malaysia and Singapore, most human infections resulted from direct contact with sick pigs via respiratory droplets, contact with throat or nasal secretions from the infected pigs, or their contaminated tissues. In the Bangladesh and India outbreaks, consumption of fruits or fruit product, example raw dates, palm juices, contaminated with urine or saliva from infected fruit bats was the most likely source of infection. The transmission because of the Pteropus bat species, it has happened. This is the transmission of the Nipah virus. The Nipah virus, it is the infected pig or the bat. When it is eating the fruits, it will infect the fruits. That fruit, when it is consumption by the human being, that is the microorganism will enter into the human being body, and the human will be the host or the case of the Nipah viral diseases. So human to human, through close contact with people, secretions and excretion also will be transmitting, or the man become a host of this disease. This Nipah virus in the domestic animals, that is the outbreaks in pigs and other domestic animals like horses, goats, sheep, cats and dogs. But highly contagious is pigs. These pigs are infectious during the incubation period, that is 4 days to 14 days. An infected pig can exhibit no symptoms, but some develop acute feverish illness, labored breathing, and neurological symptoms such as trembling, twitching, and muscle spasms. Nipah should be suspected if pigs also have an unusual barking, cough, or if human cases of encephalitis are present. The incubation period, it is 4 days to 14 days of this infection. The signs and symptoms of the infected Nipah, that is, the human infections range from asymptomatic infection, influenza symptoms, acute respiratory infections, that is mild to severe, and fatal encephalitis. The asymptomatic infections are, the incubation period is between 4 to 14 days from contacting the disease to the onset of symptoms. However, 45 days of incubation have been reported in some cases also. Influenza-like symptoms, that is fever, sore throat, sore irritation, throbbing headache, abdominal pain, fainting, nausea, vomiting, and myalgia, that is the muscle pain. And the acute respiratory infections are mild to severe acute respiratory infections, that is wheezing and breathing difficulty. The symptoms lead to atypical pneumonia and other severe problems too. The fatal encephalitis symptoms are fever, headache, vomiting, stiff neck, lethargy, irritability, photophobia, confusion, drowsiness, hallucinations, coma, seizure. Most people who survive acute encephalitis make a full recovery. 20% are left with residual neurological consequences like seizure, disorder, and personality changes. A small number subsequently relapse or develop delayed onset of encephalitis. Let's see the diagnosis of Nipah viral infection. The initial signs and symptoms are non-specific and the diagnosis is difficult because it has a common symptoms of influenza and the respiratory infections. So Nipah infections can be diagnosed together with clinical history during the acute and convalescent phases of the disease. Main tests including the RT-PCR from bodily fluids as well as antibody detection via the ELISA test. The different tests include ELISA, PCR assay, viral isolation by the cell culture. What's a treatment? No drug or vaccine specifically for Nipah infections, although this is a priority disease on the WHO and the R&D blueprint. Intensive supportive care is recommended to treat severe respiratory and the neurological complications. So the symptomatic treatment, that is very important. It is fever management, respiratory infections management, like that. Okay, how we can reduce the risk of infection among the population? Bat to human transmission. So here we can decreasing the bat access to fresh fruits. We can wash and peel of the fruits before consumption. And the animal to human transmissions, the gloves and other protective clothing should be worn while handling the sick animals or their tissues and during slaughtering and culling procedures. Avoid being in contact with infected animals. And in human to human transmission, regular hand washing after contact is very important, and wearing the full PPE, that is very important preventive measures. The operational framework at the state level, the prevention of this Nipah viral infection: avoid close physical contact with the infected people. Wear NH95 grade and higher mask to avoid respiratory infections. Wash hands regularly with soap and water. Avoid consuming partly eaten fruits. Thoroughly wash and peel fruits before consuming. Maintain personal hygiene. Cover household properly. How we can reducing the risk of human to human transmission? Here, close unprotected physical contact with infected people should be avoided. Regular hand washing should be carried out after caring for or visiting the sick people. Better to avoid to visit often to the unnecessary disturbing the infected person. Should always implement standard precautions as well as contact and droplet precautions when providing care. Waste management, that is very important. Intensive supportive care is recommended to treat severe respiratory and neurological complications. Safe burial practices. So let's summarize this topic. We have discussed about the meaning of Nipah viral infections and the outbreak history of Nipah virus in India, the epidemiology of Nipah viral infections, and the main important part, that is preventive measures of Nipah viral infections from man to man, from animal to a human being. So let me conclude this topic. The Nipah virus, it's one of the zoonotic viral diseases. So we know all the signs and symptoms, how it is transmitted from a person to person or animal to person. So we can follow all the preventive measures. Prevention is better than cure. Thank you for patience listening.